Affairs number 1. We have Sister V. Leonard, who is the consultant. Sister Leonard, can you come by me, please? Then we have Elder Duval Raddock. He is the elder for the department. Elder Raddock, up here, please. LaShawna Hamilton, she is not available, as well as Sarai Lewis, but we also have Abby Laguerre Cadet. Abby. So this is the Legal Affairs Committee missing 2. All right, thank you. This committee's objective is to serve its members by providing information or resources that will be beneficial to its members. And there are quite a few I had mentioned before. But let us keep this in mind, and I'm reminding you that as a department, we do not provide legal representation. And as such, the members of the Legal Affairs Committee will offer referrals only. And in a forum as this, we'll provide you with information, but we do not provide legal service. Okay? That's clear, right? Okay. At this time, I'm going to step aside, and I'm going to ask the consultant, Sister Leonard, to come forward. Thank you.
Good evening, everyone. So happy to see you out today. We have with us Anne Marie Thom, please forgive me. And she has over 30 years in health care. She was previously up north, and upon coming to Florida, she has continued her healthcare career, working primarily in the administration of legal services, which includes billing and other things. She has graciously consented to provide some information on Eldercare, and at each section of the program, she will open it up for questions that she can answer. And so I encourage you to take notes. It's a lot of information, and it is relevant to your lives and the lives of people you know. So I do encourage you to take out a pen and some paper and write down the questions so you don't forget anything. So at this time, I'll turn it over to Sister Thom.
Thank you, Sister V. As Sister V said, my name is Anne Marie Thom. There are some of you, let me take my glasses off. As you get older, they are for reading up close. But I've been in the Southwest Florida area for probably now was 14 years now. Many faces that I know in here, I know because, or know through my husband, Ray Thom. As Sister V mentioned, I come from healthcare. I am not an attorney at all, but my experience level is pertinent to health insurance, as I've worked for health insurance companies. When I came here, I kind of did something on the back end. I do something that we call revenue cycle management. So the best way I can say it is, let's say you go to the ambulatory surgery center. Say you need a procedure, an in and out procedure. The team that I oversee, we handle all the coding and the billing and the follow-up to make sure your claims get paid based on your insurance. And then you get a bill that we send out that is specific to what your insurance company has told you your responsibility is. So there's a full cycle. But outside of that, outside of being a wife and a mother and a grandmother, I am also a caregiver. And I've been a caregiver for my mother who has Alzheimer's for some time. And so some of the information you're going to see today, is information that I thought was pertinent that would help you. You may not be of Medicare age. May not be of or age to select certain benefits that I'm going to talk to you about today, but you may have someone in your family who you are taking care of that this education or this information that I'm going to share may be pertinent to help you kind of navigate healthcare. It is not easy. It is sometimes very confusing, and the older we get, sometimes what we hear goes in one ear and out the other, but I assure you, and I hope that when at the end of this process that you will have a better understanding of the health care that we talk about today, and that you could put some of the information to good use. All right, so let's get started. All right, so again, we're just going to be talking more so of information as it relates to elder care, and there's just such a wide variety of information that I just want to make sure we take our time to go through this, and then again, after every section that we discuss, then there's going to be a point for you to ask questions. So, all right, so the first thing we're going to talk about is Medicare. I'm hoping everybody has heard of Medicare at some point. You may be on Medicare or have someone who is about to become qualified for Medicare. But it is very important because regardless of what your age is, eventually we all are going to have Medicare at some point, for the most part. So let's talk about what that is. So Medicare is a federal health insurance. It's been around for quite some time. It was established in 1965. There are so many different qualifiers that you may have that may go into it that allows you to become eligible for Medicare. Primarily, it is for those who are ages 65 years and older, but it also allows certain people who are not 65 years of older to obtain that coverage, such as those who have disabilities, those who have ESRD, which is called end-stage renal disease, and it is funded through payroll taxes as well as premiums and just general revenue. All right, so who's eligible? Again, as I mentioned, those who are age 65 years and older, or those who are disabled and they've been receiving Social Security disability, which is SSDI, for at least 24 months. End-stage renal patients, any age, provided that they pretty much they are on dialysis or have had a kidney transplant. You also must be a U.S. citizen or a legal permanent resident who has lived in the U.S. for at least 5 consecutive years. So there's a couple of plans that are Medicare. So usually sometimes people get a little confused about the types of plans that are offered through Medicare. There are 2 parts for the most part, well, 2 main parts that we kind of know of, and I'm going to go into a couple more. There's Medicare Part A. Does anybody know what Medicare Part A is? Without looking at the slide. Hospital coverage, exactly. So I like to think of it as Medicare Part A really is for your inpatient care. If you're going to be in a facility more than 24 hours or more, it also covers skilled nursing care. It covers hospice care and some home health care. Often, most people do not pay a premium for Part A if they or their spouse paid Medicare taxes while working. Now, on the flip side, most of you are more familiar with Medicare Part B. For those of you who have a lot of doctor's visits and have reached Medicare eligible age, it covers outpatient care, doctor's services, preventative visits, and even some home health care. It does require that there is a payment of a monthly premium, which it does vary based on your income. There is also another part of Medicare, which is called Medicare Part C. That is your Medicare Advantage plans. So many times you may get phone calls for those of you who are eligible for Medicare or have family members, and you're on a traditional Medicare plan, but maybe they want to offer you an additional benefit so that you're not having to select multiple plans. So, your medical, your pharmacy, and other things. So oftentimes you'll hear the term Medicare replacement or you'll hear Medicare Advantage. Those are considered Medicare Part C. And that is an alternative, again, to the original Medicare Parts A and B. And they give you additional benefits. Sometimes you can get hearing coverage, vision and dental, which some of those things are not readily available through your standard Medicare plans, Medicare Part B plans. And then there's also Medicare Part D, which is your prescription coverage. It provides a lot of benefits because traditionally you do not have standard pharmacy coverage under your normal Medicare Part A and B, but there is a requirement for you to have prescription drug coverage because, as we know, as we get older, even myself, we take medicine, and medicine is not cheap. So we want to make sure we have adequate coverage. Then there's Medicare Gap, or the Medigap. It is considered what we call the Medicare supplement plan. So if you have a Medicare plan, you'll know that there is patient responsibility that you have. You may have a 20% coinsurance. You may have a copay for whatever reason or whatever type of benefit that you have received. You may not have $20,000 if that's 20% of what the claim or your responsibility is. And so what's important for you to understand is that getting a Medicare supplement insurance, typically, as long as they're a valid Medicare supplement plan, it will cover that patient responsibility. So that's just one big thing that, and not everyone gets it, but oftentimes it is a great added benefit because it limits your out-of-pocket responsibility. Okay? So let's really dive into, again, Medicare Part A and the cost. So most people do not have to pay a premium for Part A Medicare because, again, it covers your skilled nursing care, your inpatient care. But the big thing about it is for those who haven't paid Medicare taxes for at least 40 quarters, the premium can be as much as $505 a month, and that's as of 2024. And those who have the traditional Medicare plan typically have to pay a $1,632 deductible for a hospital stay during each of the benefits years, which usually runs from January to December. But again, you may have additional copay responsibilities depending on your plan. So you want to make sure that you're aware of that. And it can be very costly, especially for those of you who may be on a fixed income. A sudden admission to a hospital, it can really deplete your savings account. So you want to make sure that you're aware of all of the benefits. Medicare Part B. So most people pay about $174.70 a month for Part B as of 2024. And that covers, again, your doctor's visits, your outpatient services, but you may pay more than that if you're single and you earn more than $103,000 a year, or if you're married and your earnings are more than $206,000. You also have a $240 annual deductible that you have to meet before Medicare pays out anything. And then, as I mentioned, once you've met your deductible, you have a 20% coinsurance. So think about if you have a large hospital bill and you've been in the hospital for, let's say, 2 weeks, think about what could be racked up as your responsibility, and you're having to pay 20% of that. So just keep that in mind. So Medicare Advantage. So we're going to talk about Medicare Advantage, but I'm going to pause for a little bit on this slide because there's a lot that goes into Medicare Advantage plans. Some good benefits, some not so great benefits, but we're going to go over all of that. So if you choose to select a Medicare Advantage plan, you still have to sign up for Parts A and B of Medicare, but you will get your health care and often your prescription coverage from that private insurer because most of your Medicare Advantage plans, they are through companies like United Healthcare or what are some of the big ones? Humana. They actually cater to that because they know the need of the aging and they know that they don't want to have more than one plan that they're paying for. And so there's one plan that gives them all the benefits that satisfy Medicare requirements. So your premium, typically for the most part for Part A, which is the inpatient services, it is free. And that's for most, not everybody. But then you have $174.70 a month premium that's due for Part B. And again, that's for most people. Those who are high earners, you may have to pay more. And then again, depending on which Medicare Advantage plan you choose, you may need to pay a monthly premium in addition to the Part B premium. The one thing I want to talk about Medicare Advantage, though, is that there are different types of Medicare Advantage plans. So you have to be very conscious of what you are selecting to make sure it meets your needs. You have some policies that do not or only allow you to see providers that participate with that insurance. Then there are other plans that allow you to see providers that participate as well as those who are out of network. So usually what I tell people is when you are selecting an Advantage plan over the traditional Medicare plan, the big thing you need to make sure is, are your doctors participating with that plan? Because if they're not participating, then you could find yourselves in an extreme financial deficit, and you do not want that to be occurring, okay? You are also responsible when you're on these Medicare Advantage plans for any copays or deductibles. And again, your responsibilities will vary overall. And I'm trying not to read verbatim because I don't like reading verbatim, but I want to give you as much information as possible. So bear with me. You will also be responsible for any copays and any deductibles that are pertinent to that plan. Not every Advantage plan is the same. So it's really important that you get someone who can help you understand before you make a switch from your traditional Medicare to Medicare Advantage plans, okay? So Medicare Part D, this is the prescription coverage. So again, if you do not have prescription coverage from a retiree plan, then you can buy this as a standalone. But again, it will cost you. So your monthly premium varies by the insurance company because most of these are provided by private insurance plans. The deductible typically is $554 or could be lower depending on the plan. And then also remember that if you do not have prescription drug coverage that's as good as or better than Medicare Part D for 63 or more days in a row, you may have to pay a penalty for the rest of your life if you sign up for Medicare Part D at a later date. So it's very important that you are following the normal process and understanding your plans because it will affect you over time. Then there is Medigap. Medigap or your Medicare supplement policies. And again, those are, so say you are on a traditional Medicare plan, you have 20% coinsurance or deductible that you have to meet. And then what are you gonna do? Do you have that money, especially if you're on a fixed income? Probably not. So you wanna make sure you secure a supplemental policy that will cover the responsibilities. So one cautionary note is when you are selecting a Medicare replacement policy, you must, and I have to implore you, make sure that that is a true Medicare supplement policy. There are some people that will sell you or give you a call and say, oh, I'm gonna give you this plan, it's so great, but it's not a true, what I call wraparound Medicare supplement policy. And what'll happen is they'll send the claims to them hoping that they'll pay all of your Medicare insurance, copay and coinsurance, and then they still have a high deductible that you have to meet, so really they're not paying anything. So only the true Medicare supplement policies typically will help satisfy or diminish your out-of-pocket responsibility, so make sure you are doing your due diligence and asking the necessary questions. So again, just a couple of things about the eligibility. We've touched on this a little bit before. Medicare Part A and B, there's automatic enrollment at age 65 if you're receiving Social Security benefits. Individuals under 65 qualify after 24 months of SSDI or with a diagnosis of end-stage renal disease. Medicare Part C, the Medicare Advantage, you must be enrolled in both Medicare A and Part B. There is no age restriction, but it is offered by private insurers, and your benefits or whatever that you're going to be paying does vary. Medicare Part D, your pharmacy coverage. Again, you must be enrolled in Medicare Part A and or Part B, and it's available to all Medicare beneficiaries regardless of your income level. And then as we just talked about, the Medigap world, which is the supplement policies. It is available to individuals who are enrolled in Part A and B, and you must purchase it within 6 months of enrolling in Part B to avoid higher premiums or denials based on health conditions. That's sometimes what we call pre-existing conditions sometimes. All right, so are there penalties if you do not select a plan when you become eligible for it? So if you miss enrollment deadlines, you could end up with lifetime penalties. So as you approach 65 or as your loved one approaches 65, you'll want to enroll in Medicare during the initial enrollment period. And this 7-month period spans the 3 months before the month in which you turn 65. And that's through 3 months after turning 65. If you're already receiving Social Security benefits or railroad retirement benefits, at least 4 months before your 65th birthday, you'll be enrolled automatically in both Parts A and B of Medicare on the first day of the month that you turn 65. Or if your birthday is on the first day of the month, your automatic enrollment will begin during the previous month. Certain states have different stipulations. Puerto Rico is one of them. I'm not going to go into that, but just wanted to make you aware. Now, if you or your spouse are working and you have health insurance coverage through an employer with 20 or more employees, then you can delay signing up for Medicare, but the big Caveat to that is the minute you lose insurance, you must enroll in parts A and B within 8 months of losing that employer based coverage, or you're going to have to pay a penalty. So for Part D prescription drug coverage, it's a little bit different. You have only 2 months to enroll after you've lost coverage. That's considered a part, or at least as good as Medicare to avoid penalty. Meaning, once you find a Medicare Part D plan, you must enroll within 2 months, but it has to be comparable. It cannot be less than what would be the requirements for you for Medicare Part D or pharmacy coverage. Additionally, if you enroll late for Medicare Parts A, B, and D and Medigap plans, again, there may be additional penalties. So for Part A, if you're among the 1% who have to pay for Part A, the monthly penalty would be an additional 10% of the premium. That's a lot. And you'd have to pay for it twice the number of years that you delayed your enrollment. For Part B, the penalty is an additional 10% of your premium for each full 12-month period that the enrollment is delayed. And it is charged every month for as long as you have that Part B coverage. For your pharmacy Part D coverage, the penalty for late enrollment is an additional 1% of the national base beneficiary Part D plan premium for each full month that you do not have it or an employer or retiree plan that meets Medicare standards. And you also have to pay the penalty for as long as you're enrolled in that plan. For your supplement plans, in most states, they're through private insurance, and so Medicare supplement plans, they may deny coverage for you or charge you more because you have a pre-existing condition. If you apply for switching policies more than 6 months after signing up to Part B. So it's really important that you're paying attention to open enrollment guidelines, and we're going to go into in a second, for your loved one or for yourself, because again, you could truly have some financial deficits that we definitely don't want you to have. So a question comes up, if I selected a Medicare Advantage policy and I don't like it, and I want to go back to Medicare, or I want to shop around, can I do that? So you can, but you can only do that during set periods or set times of the year. So there's 3 ways you can do it. Either one, through the normal open enrollment for Medicare, which is from October 15th to December 7th. Again, you can switch from that Medicare Advantage plan back to the traditional plan, and that will become effective, or that change will become effective on January 1st of the following year. If it was a Medicare Advantage policy that you were on, then you can also go through their open enrollment, which is usually from January 1st to March 31st. So if you're already on a Medicare Advantage plan, you can switch again to another plan or back to the traditional. But remember that if you go back to the traditional Medicare plan, you are going to still have to find a Medicare Part D, which is a prescription plan, because switching back to traditional, that normally does not come with the pharmacy coverage. Now, if you switch, again, back to traditional Medicare, you need to apply for a Medigap policy. Remember, the Medigap is that Medicare supplement policy that helps cover some of your out-of-pocket expenses. So it's really important that you ensure that you are following the guidelines for Medigap. The one thing I'll tell you about Medigap is that you may not automatically get guaranteed coverage because it is based on whatever that payer's eligibility requirements are. So just keep that in mind. So where can people find Medicare plans or compare plans? You can either call Medicare, which I suggest, but they have long hold times, at 1-800-MEDICARE, or you can go on the medicare.gov website. Okay. So we know that we are going into the open enrollment period for Medicare. So what are some of the changes for Medicare in 2025? So there are quite a few changes that are coming up. Some things have not been finalized at this point, but I'm going to go over at least what we do know. So one of the biggest updates in the introduction of for the changes for 2025 is the introduction of a $2,000 cap on out-of-pocket prescription drug costs for Medicare Part D plans. This applies to standalone Part D and Medicare Advantage plans with drug coverage, and that greatly benefits those with high medication expenses. Additionally, in what they call the infamous donut hole or coverage gap is being eliminated, making it much easier for enrollees to predict their costs for the year. Again, if you're on a lot of medications, this could significantly impact you financially. Other changes are expanding benefits under Medicare Advantage plans, such as enhanced mental health services and more support for dementia care through what they call the GUIDE program. And then again, part of this is it also tries to help those who are caregivers If you're a caregiver of someone who is of Medicare eligible age, you know that that is not an easy job. So you want to be able to have certain benefits afforded to you, such as what I call respite care. If no one knows what respite care is, if you're taking care of someone full time, you want to make sure that you have time for you. Respite care doesn't mean that you don't love your family member, whether it's your mother, father, whomever, any less. But you do need to recharge. You cannot give from an empty cup. So respite care being added to, as one of these benefits is definitely going to be very impactful. Okay. Then also for premiums, deductibles, and copays, while the exact figures they have not finalized, at this point we do know that it is the deductible for Medicare Part D, which is the pharmacy benefit. It is expected to rise to about a little over $500, and then the Medicare Part B premium, usually depending on inflation, that may vary a little bit, but for right now, there's no further information that we have about the 2025 changes. So again, just kind of a summary of what we talked about. Medicare is appropriated and is essential for those who are Medicare eligible or those who may qualify for it. It does provide you with benefits that you may not get on a regular standard plan. Additionally, just understanding what your eligibility requirements are for these plans is important. And then also making sure that you review all of your available options so that when you're going through the open enrollment period that you understand what coverage that you need to select and which coverage best suits your individual needs. Are there any questions about anything that we've talked about so far? Yes. Mhm. Well, the big thing about it is, especially with Medicare Part D, is that you want to kind of strategically, when you lose that coverage, the big thing is don't wait the 8 months. Don't wait it because it just yeah. I will say this: it is a paper trail. It is the government. So there are a lot of processes that are in place that sometimes don't make sense, unfortunately. But that's why we just want to make sure that you're aware of this information. I say as soon as you lose coverage, enroll in both. Just do what you have to do to get the process rolling. But his point was the waiting periods that you have to do, or the time that you need to convert once you lose your coverage if you're on a group sponsored plan. Why is there such a disparity between the two? Well, the disparity is because that is the way the government set it up, unfortunately, and because sometimes your Medicare Part D is a standalone policy. That's where there are different constraints for those standalone policies as it relates to pharmacy. Okay. I think. Oh, in the back? There were two hands I saw.
You said that once we reach 65,
I can hear you.
you're automatically enrolled in Medicare. Are you enrolled in A and B or just the regular Medicare?
It depends on what your situation is. If you are on Social Security, you are enrolled, but you do need to make sure that your qualifications or what your current status is meet the standards for qualification. So what I tell you to do is get a hold of Medicare, let them know what your situation is, to let them know whether or not you're going to be qualified for both, or if you have to separately enroll, because some of this is driven by cost as well. So we want to make sure that you're getting the most accurate and correct information.
Okay, so would we apply
Yes, you would need to reach out to
before
Medicare.
we reach 65, like those gap months or 7 months?
Yes, I strongly suggest that as soon as you're ready to start talking about it, you can even reach out to them now. You don't have to wait. If you're close to it, call them and let them know what the situation is and have the specialist at Medicare walk you through their processes. It is not, what I tell people is not for the faint of heart, but if you're talking to people that are not well versed in Medicare, they can steer you wrong, and not because of their choice, but because they're just not they're not aware of your individual situation. So Medicare will give you questions, they'll ask you questions specific to your individual situation, and they will provide you with whether or not you need to enroll in, if you're going to be automatically enrolled or not. Okay.
Your wife.
She says a hand, and I think there's one here.
I was told recently that if you have Medicare, you will be eligible for Medicaid. Is that correct?
So Medicaid has its own separate eligibility requirements. So, and I'm going to use my mother as an example. My mother had been on Medicare for quite some time. She was not eligible for Medicaid automatically. She had to go through a whole enrollment process, and Medicaid is income-based. So we're going to actually, Medicaid is probably the next one we're going to talk about. So don't think that it's an automatic process. You have to actually enroll with Medicaid, and then you've got to follow their guidelines, depending on your individual circumstances. Does that answer your question? Okay. I think, did she have a question?
Thank you. My question concerns Medigap.
Mhm.
Um, if I'm understanding what you're saying, it's if someone has like a whole lot of complications or you expenditures, it might be a smart thing to do. If you don't have complications like that, right?
Mhm.
And let's say I don't know what the enrollment stuff is, but you choose not to enroll. Do you have to enroll at 65?
You do not have to enroll for your Medigap coverage, but you do have to follow whatever that individual payer's requirements are for enrollment, because Medigap typically is through a private insurance, and
Okay.
they may have different eligibility timeframes for enrollment.
Oh, okay.
So even if you don't have a large number of expenses, keep in mind that at some point you're gonna be at a point where you're not working anymore. You're gonna be on a fixed income. Some people, as this days and age, they still have mortgage to pay. So the more you can limit your out-of-pocket responsibility, even for regular office visits and things like that, where you don't have to come out of the pocket, I highly recommend it.
Oh, okay.
I
Got it.
highly recommend it.
Okay.
Yes. Okay. Oh, there's one question back there.
What I was going to ask is that there's an age group that are in their 50s that should be looking to straighten things out early before they end up in
Yes.
that. And I
Yes.
want to address some of the things that I'm hearing about Medicare and Medicaid as of being the age that I'm at right now, right? And I already used my company to straighten out a few things because I had some health issues, right? In the hospital and paying the debt. And what I'm trying to get to this concept in our minds is that we should become wealthy so you don't end up on that thing. And that's really
That
what
would be
everybody
great.
should come to their senses, that we always take the handout but don't realize what in turns it's going to be for yourself. So I really think that everybody should get that in their mind, that you should be doing something so you don't end up on it. That's what everybody should be thinking about right now for the people in their 50s and 60s just getting there. So I really want, there's nobody here to tell that to because they're all not here, right?
Understood.
So I wish everybody would think like that.
Yeah.
Try to figure a way to become wealthy so you don't end up using that thing.
That's hard. That's easier said than done though, because though especially as we go through our economy right now and the prices are increasing, but that is a valid point. Start planning early. Sometimes, when people start planning and saving and putting money and talking to, various entities that can help them save and whether it's CDs or whatever it is, it's important for you to start when you're young. So if you have young children, I strongly suggest that you really start looking at what you can do to help them. Because sometimes you literally saving a certain amount a month from when a child is, when they're born up until the time when they turn 18, they can amass so much money. And then continue to teach them how to be financially and fiscally responsible. That will help them so you're not in these situations where you're relying on it. Unfortunately, because of how the world is right now, there are a lot of people who can't afford to, they're not rich. And unfortunately, because our gaps in terms of rich, middle class, and lower class, the middle class is going away. It's going away. So where we once thought Where we once thought that we would be comfortable, now I think I saw something on the news the other day where to live in Florida comfortably, your combined income has to be no less than $235,000 approximately to live comfortably. So you have to think that was not the case many years ago, but with the economy, things are changing. So, absolutely, well said. Yes. Yes. What I would tell you to do is reach out to Medicare, let them know what that person's individual situation is, so that they can be the one to tell you whether or not they're going to qualify. They may tell you to just fill out the information or go through a series of questions in order to determine that. But I don't want to say that yes, that person will be, because there could be other situations that you may find out that may disqualify for them. So let Medicare be your guide and talk to them directly.
I don't think most of us heard the question, so could she ask it again, please?
Okay.
No, I was asking if you have an elderly person migrated here, never worked before, become a citizen for 5 years, are they eligible for Medicare?
Yeah. And if you heard my response, make sure you're reaching out directly to Medicare. Let them know what the situation is, because there are so many different eligibility requirements. I put a few that were up there, but there are other things that Medicare is going to ask you that you need to meet. So that person really needs to reach out to them and let them know so they can give you the proper answer. Okay? All right. So let's go into Medicaid. So Medicaid, again, it's one of those joint programs that provides health insurance more so to low-income families. Alongside with Medicare, it also was established in 1965. And again, it's there to help just limit your out-of-pocket expenses. It is one of the largest sources of health care in the United States because it covers over 80 million people. Usually when you hear someone talk about Medicaid, sometimes you'll hear them say it's the payer of last resort. Because if someone has Medicaid and they have other insurance, Medicaid will never be the primary insurance. It will always pay the last because their fee schedule is very small, it's very low, and they're just trying to make sure that at the end, if you all of your insurance plans, they are making sure that you are not liable for anything. So sometimes we get some patients that will come in or to a doctor's office and they will, instead of giving all of the insurance, they'll just give Medicaid, and Medicaid denies it. And says, we show, because all these health insurances are connected, we show that you have insurance, someone else is liable for it. One thing I will say to people, and I'm going to say even later on, is make sure you are opening your mail. People have a tendency when they get something in the mail to just not pay attention to it, but please make sure, especially now as well as you get older, a lot of the information, you're getting communications from your insurance plans through the mail. And so if you're not reading it, sometimes you can, of course, increase your financial responsibility because you just failed to respond to something. It could have been simple as, who's your primary insurance? And you didn't respond, and now there's no more time, or the timely filing for that claim to be reprocessed is gone. So open your mail. I know sometimes like me, I'll come in, or my husband will come in, and we'll throw the mail down on the counter. You have to get to the mail. It's important. It is. All right. All right. So who is eligible? So who is eligible for Medicaid it's based on income. So, and that's determined as a percentage of the federal poverty level. The exact income threshold, it varies by state. So what the requirements are for Florida are not the requirements for, say, Maryland, because again, our cost of living is different, and you need to make sure that you're aware of that. There are what they call variables in terms of eligibility. So there may be certain groups that are more eligible or may have additional benefits, such as children, pregnant women, parents and caregivers, elderly and disabled, and there are different constraints with regards to theirs. So for example, for pregnant, you're generally eligible with higher income thresholds to make sure that you are getting proper prenatal care. I don't know if you've heard of WIC. Right? For those of you, women, infant, and children. So a lot of those processes came out of this whole understanding of that there are responsibilities that pregnant women need in terms of making sure that their babies are going to be healthy and to make sure that they're also eating. So all of that is tied to this whole large process, and make sure that you understand that. Elderly and disabled. So individuals who may also qualify for supplemental Social Security income, which is SSI, may become eligible for Medicaid. Also, citizenship. You must be a U.S. citizen or a qualified non-citizen, as well as state, well, everything's going to vary by states. So states that have flexibility to expand coverage, and I will get into this in a little bit because not all states participate or have decided to expand Medicaid coverage. There are certain states that have not. Florida is one of them. And that's really vital because if you have a large demographic of people who are lower income and they don't have all of the added benefits where they can't go to certain payers and providers because of their type of plan that they're on, sometimes they just don't get care. And that's not what we want. What we want are people to have insurance that's available to them and have plans and coverages so that they'll be able to get their services covered. And I'm not sure why Florida has not done it yet. There's so many different politics that go on with that, but hopefully through legislation you will be able to push your legislators to help to expand the Medicaid coverage for Florida, but that's a long process, as we know. Overall, the big things, and this is very small. I'm going to turn around just for a moment. So there are different types of Medicaid plans. So if you got your fee-for-service, that's your traditional Medicaid plan, and it pays your health care providers directly. Beneficiaries have the freedom to see any provider who accepts Medicaid. And I want to say something about accepts. Be very careful when you are going to a provider that says, oh, I accept your insurance. Accepting your insurance does not mean they participate with your insurance. So you can get yourself in a world of hurt if you go to somebody and you rack up so many dollars in bills or thousands of dollars in bills, and they say, well, we told you we accepted it. We didn't tell you we were contracted. So I always say make sure that you go in, get the name of that provider, call your insurance company, and confirm if they're actually participating. Because without that, you are just flying by the seat of your pants, and that's not good. All right, so outside of the fee-for-service traditional plans, you have your managed care plans. Those are the plans that, again, these are through commercial or private insurance plans that they have decided they're going to offer a better benefit. Sometimes the good benefits through managed care plans are sometimes they offer transportation. So they will take people to and from their doctor's appointments. And that's something that is not readily available to any of us. I'd love for somebody to take me to my doctor's appointment. But these are some of the benefits that some of these managed care plans have. Correct. She said you need to go to PACE. All right. But managed care plans are the most common form of Medicaid today. And I will tell you that sometimes you're in certain states that even though you are entitled to Medicaid, certain states will force you to take a managed care plan, that you cannot be on the standard Medicaid plan, and that is because of their relationship with these big insurance plans. So it just depends. When a person becomes eligible for Medicaid, they will tell you what you need to be enrolled in. All right, the other things are, or options for the Medicaid plans are home and community-based waivers. So they allow states to provide long-term care services in a home or community setting instead of being in an institutional setting like nursing home. And for most part, the individuals who need this service are those who would otherwise need institutional care, mostly the elderly and disabled. And then again, we talk about the Medicare expansion. So with the Medicare expansion, it is under the Affordable Care Act. It allows states to extend Medicaid coverage to nearly all low-income individuals under age 65, right? Only 39 states so far have adopted the Medicaid expansion as of 2024, but sadly, Florida is not one of them. So you could understand if you're in an area that geographically that has a very high population of low-income individuals, they would be deserving of this. They would need this to help them. But unfortunately, through whatever reason, Florida is not on board yet. We're going to get them there, though. Eligibility for these Medicaid plans, the fee-for-service, everyone is eligible. All those who are Medicaid eligible typically are eligible, but typically it's used in states that do not rely heavily on managed care. That goes back to what I said. Some states, even if you're eligible for Medicaid, they may not put you on a traditional Medicaid or fee-for-service plan. They will put you on a managed care plan instead. With managed care plans, again, the eligibility is most Medicaid beneficiaries and those in states with widespread managed care adoption. Enrollment can be mandatory or voluntary, and again, it depends on the state. Then you also have home and community-based waivers, and those are individuals who need a high level of care, such as those who are disabled or our elderly population. And your eligibility depends on the state that you're in. jumping down to Medicaid expansion, those are for adults aged 19 to 64 who meet certain income requirements, and it's only available in those states who have expanded Medicaid. So the biggest thing about Medicaid is that it is a critical program. There are a lot of people that are out here who cannot afford to live. I saw something on the news the other day, and it spoke about the fact that the homeless population has shifted. We now have more homeless population within Southwest Florida who are people who have PhDs, who masters. And so because that is ever evolving, it's programs like this for Medicare that will help them, because perhaps they're in a poverty situation. They might be. We have so many people that are out there who are in need. There are a lot of people who look and say Medicaid is just a handout. It's not. It is not a handout. People pay into this. Your taxes pay for it. You should be able to tap into whatever is available, especially if you've been working all your life and you get to a point where you need health coverage and you can't get it. Not good at all. So again, just understanding how Medicaid works, again, it is not an automatic process. You have to meet certain criteria in order to get coverage for it, okay? Any questions about Medicaid? None? A little bit more, oh, yes.
Is Medicare better than the Medicaid?
So Medicare, because I have a parent that's on all of them, Medicare and Medicaid, each of those plans is great in its own right. Medicare there are certain things that Medicaid covers for that Medicare won't. Oh, I'm sorry. Let me push this up, sorry. So what I was saying was each plan is good in their own right. So there are certain things that Medicare will not pay for that Medicaid will. And I'll use an example. When my mother I had moved my mom from Maryland to come live with us because she has dementia. And at the time, she did not qualify for Medicaid. Once we got her qualified for Medicaid, the one thing that I wished that we were able to do was to get her qualified more quicker with Medicaid, because I was paying for adult daycare. And adult daycare was about $300 to $400 a week, depending on how many days. Medicare doesn't pay for that. Medicaid pays for that. I was also paying for, my mom was incontinent. Medicare did not pay for diapers. It didn't pay for any of that stuff. Medicaid does. So there are so many things that each of these plans in their own right they're good, but when it comes to it, sometimes you just have to see what are your individual needs in order to determine what's best for you. I will always say, if you can get someone qualified for Medicaid in addition to your Medicare, do it, because you never know what's going to happen, and we need to be more proactive and not reactive to things. Because I will tell you, from my personal experience, getting my mother certified for Medicaid, it took us a year and a half. Not because there was missing information, it's because, unfortunately, the Medicaid system is bogged down, and you have to stay on top of them. So they would ask me for information, I would submit the information online there's a portal, and no one would look at it. So I literally had to send reminders to myself, all right, time to call again, time to call again. And sometimes you'll even get denial letters for information that they already have. So the process is not easy, but you have to be diligent about it. So my suggestion is, if you have the ability, get it. Just know that it may not be very easy.
One more question.
Yes.
What are the eligibility to be qualified for Medicaid?
So there's a long list of things that are eligible, and so we're going to get a little bit later into the area on aging. There is a place that you can actually call. They will actually send you through what we did was they gave me almost like a 1.5 hour to 2 hour interview where they ask you a lot of questions. They say, is this person incontinent? Is this person, a myriad of questions. Based upon that, they will tell you whether or not this person could be eligible. I will tell you also one other thing, just going back a little bit to your other question. My mom, there was a certain point where my mom could no longer be in my home. She was a danger to herself. My home was 2 floors. She would like to climb over the top, because cognitively she did not have that depth perception. So it became, through her neurologist, important for us to move her into memory care. That's not covered by Medicare. So the fact that we were able to get her certified through Medicaid, now I don't have to pay anything out of pocket other than the fact that she pays up to whatever they're saying that her responsibility is, but that comes out of my mom's Social Security that she gets every month. So it's things like those, going back to that, your original question, that's important for you to know, because there are so many different plans, there are so many different things that are covered under Medicare or limited in coverage, that by having Medicaid, it will help pick up and help you so that you don't go into financial ruin. Yes. Yes. Was that answer your question? Okay, good.
I think you answered my first part of my
Okay.
question. I was about to ask if you could have both. I think you answered that, right? But my the second part of my question is, if you're qualified for Medicaid in Florida and you move to Georgia or you move to Pennsylvania, will you still be qualified, or you got to do the
You
process
need to
all
go
over
through
again?
the process.
Again?
You need to go through the process. Each state has different requirements. So you need to go, before you plan, before you plan to move, you need to get a hold of that state's Medicaid and find out what their requirements are. There may be some of them who say, oh, with this documentation, or because you've been on this period, this length of time, we may be able to get some of that information so that the process is not as arduous, but it is not, it is not multi-state. It does not carry over. Yeah. Well, COBRA's a little different. Yeah, COBRA's a little different. What he's talking about when he says COBRA, so if you have been working at your employer and say, for example, you get laid off, within 31 days, they'll give you a packet of information and they'll say, you can continue continue the same coverage that you had while you were an active employee, but under a COBRA plan, and that's federally mandated. The only problem is, when you are working for your employer pays a portion of your premiums, right? If you have a wonderful employee, some of you don't pay anything. You don't have any payroll deductions, right? But for some of you, you may be thinking, my plan pays nothing. I'm paying like $800 a paycheck. Oftentimes, that's because your employer is chipping in less for your cost for insurance. But when you go on COBRA and you become eligible, you are paying 102% of the premiums. You're not getting that help from your employer. So sometimes you'll see your COBRA premiums on a monthly basis could be $3,000, whereas before you may not have been paying anything. So COBRA does still exist, but it just depends on your situation. It's not something you can just elect to get. Mm-hmm. Yes. Mm-hmm. No. And some plans will tell you your insurance plan is only good within this area, or it'll say you can only travel outside the state for 120 consecutive days. If you're out of the state, that masters that it's over that plan more than 120 consecutive days, your coverage will be terminated. So you have to be very careful when you are, even now, when you're going from state to state and you have those types of plans, even a group plan sometimes. If you go to stay for 6 to 8 months somewhere, find out whether or not you are going to have coverage, because sometimes it is not what you think. It is not. Health insurance is a lot. There's a lot of education that you have to have. Great questions, though. Anyone else before we go on? All right, so let's talk a little bit about Social Security. So what is Social Security? It is a federal program in the U.S. that provides financial assistance to retirees, disabled individuals, and survivors of deceased workers. It was actually established by Franklin Delano Roosevelt's New Deal in 1935, and it just wants to give you a safety net for individuals during retirement in the event of disability or death. It is funded through payroll taxes under the Federal Insurance Contributions Act. Okay. So who is eligible for Social Security? So it's based on work credits. So eligibility, those work credits are earned through your employment. So generally, if you have 40 work credits, which is the equivalent of 10 years of work, that is what's needed to qualify for these retirement benefits. Fewer credits may be required for disabled or survivor benefits. In terms of your age, your full retirement benefits are available at the full retirement age, which varies between 66 years of age and 67. It all depends on what your birth year is. And if you have, you may get some reduced benefits as early as age 62. Also, if you're disabled, eligibility for SSDI, which is Social Security Disability Insurance, it requires a medical condition that meets Social Security's definition of disability, and you also have the sufficient work credits. When it comes to SSDI, I tell people who, if they have a disability that they believe is covered, they are going to be up for an uphill battle trying to get qualified for SSDI. You need to get someone, sometimes an attorney, that will help you navigate the process to get SSDI, because just because your diagnosis is on that list of covered element, you probably won't, because they're going to take you through all kinds of steps to qualify. How many times have you gone to the doctor? How many doctors have certified you for this? It is not an easy and automatic process, and sometimes for some people, they are working on this for years to get SSDI. It is not automatic. And then also, who else is eligible for Social Security? That's survivors. So spouses, children, and in some cases, other family members may be eligible for survivor benefits if that deceased worker earns sufficient work credits. So just a little bit of an overview. So your retirement benefits, the devil's busy. I see somebody up there. All right. So for I think the information is overloading the computer. It's hot. All right. So your retirement benefits, it provides monthly payments to retired workers who have earned sufficient work credits. The amount is based on lifetime earnings and the age at which benefits are claimed and other factors. Your SSDI, which we talked about, your Social Security Disability Insurance, it gives financial assistance to those who are unable to work because maybe they have a severe long-term disability, but you have to have those work credits and a medical condition that meets Social Security's definition of disability. When they say strict, it is strict. You also have to have supplemental security income and a needs-based program that provides financial assistance to elderly, blind, or disabled individuals with limited income and resources. But unlike SSDI, SSI is funded by general tax revenues, not Social Security taxes. Also, for survivor benefits, these are paid to members of deceased or family members of a deceased worker who earn through work credits, and eligible recipients include widows, widowers, children, and sometimes parents and other dependents. And also, even Medicare is listed in here. Even though it's really separate from Social Security, eligibility for Medicare is often tied to receiving Social Security benefits for those retirees and those with disabilities. And so we've talked about this piece of it. I'm not going to go into all of this information, but again, with Social Security, there's just a wide variety. You do not automatically qualify for certain things. As we know, you need to go through the process of reaching out to Social Security, making sure that your situation meets the requirements for eligibility, so that you are covered. I will tell you, sometimes, if you've had enough work credits and things like that, it works like clockwork. But if you start having situations where you are disabled, again, as I stated, please get an attorney to help you navigate the system because it is very full of red tape. And again, just a summary, it provides crucial financial support to retirees, disabled individuals, and survivors of deceased workers. It's important to understand the eligibility requirements and the types of benefits that someone's is entitled to, even just their families. And then the eligibilities are based on the work history, their age, their status in terms of disability, and in some cases, their financial need. Any questions? What I tell people is to reach out to Social Security, because at that point, there may be other benefits that you are entitled to, and they may be able to tell you that. But without knowing your specific situation, don't assume that you're not eligible for anything. It may just be reduced. Okay, great question. Over here? Oh,
Hi. To earn work credits, do you have to be like corporately employed, or can you be an independent contractor and then just pay your taxes at the end of the year? As long as you file taxes, you're fine.
if you're filing taxes, as long as it meets that credit requirement, you should be good. But again, depending on your situation, especially if you're an independent contractor, again, I suggest you reach out to Social Security. Talk to them to make sure. We don't want you to get into a situation where you think you're going to be eligible for it and you're not. And you can do it sooner. You don't have to wait until you get to the point where you believe it's around that time for you to start getting it. Ask the questions now. Be prepared.
So I'm not sure I understand the difference between SSI and SSDI. Could you just explain that a little bit for
Yep.
me? Please.
All right. So your SSI, that is for your supplemental security income. Those are for individuals who are age 65 or older, or they're disabled or blind. They have limited income and they have no work credits. But they have to meet certain income requirements. Your SSDI is a little different because those are the individuals who cannot work because they have a disability. And they still have to go through and follow their normal criteria because, again, with that, you have to have sufficient work credits, even under SSDI. But again, it's based on the age that you were at time of disability. So does that help answer that question? Okay. Yes, sir.
Once you're qualified for Social Security, what is it the same amount you get every year, or what makes it goes up or goes down?
You get different amounts, and it just depends. Sometimes there's COLAs, cost of living adjustments, that happen. So every now and then you will get a letter. Like my mother just got a letter a little while ago, and it just said there is a cost of living adjustment, and as a result, your Social Security is changing. That amount is changing. But I'm going to say this. When you have Social Security, if you are someone who is applying for Medicaid, because it has to go back to Medicaid, anytime your income goes up, you have to report it to Medicaid. Because your information that you are getting qualified on is based on the income that you had at the time that you put your application in. Any changes, any assets that you acquire after that point, you have to make sure that you let them know. And they need those letters, which goes back to open your mail. Because you can't just wait for the change in direct deposit. You have to make sure you're really being on top of the documentation that you have. Can you help? Elder Reddick? Elder Reddick? We have a couple people with questions. Right here? Right here? Right here. Next to the camera.
If I don't see your hand, I don't know who to hand the mic to.
Okay, my question is, like, if you are your employment, like, you provide with FRS benefit, would you also be eligible for Social Security if you're employed, like, for the government? You know, you have Florida retirement, like, I don't know if you FRS.
I'm not familiar with FRS, but again, that question I would direct you to reach out to Social Security Administration to confirm if you're eligible, because I've not been familiar with that plan, so I want to make sure that I'm speaking intelligently. Yeah. Yeah. Is it your pension? And I'll say it this way, and maybe this will help. So my mom she's got her Social Security, but she also gets a pension separately. It's two separate things. So is that plan part of a pension? Okay, so then you should be fine. But again, your stipulation though is those are two separate plans that you're gonna get. Your pension is not the same thing as your Social Security. It's two separate amounts. Mm-hmm. Yes, you can. Yes.
Yes, I'm not 100%, but I work with the government, so I do have FRS. So that is totally different from Social Security.
Yes, it is.
And with the FRS, is almost like the pension, but you have the pension or you have the retirement plan. The retirement plan, well, you have the investment plan and the pension. The pension is, you can have it where you get it monthly, just like your Social Security. The investment plan, it's a lump sum. So if you're
Oh.
in the investment plan, when you retire or you leave employment, then yes, it's a lump sum that you get.
Okay.
But that has nothing to do with Social Security.
Correct. They're separate.
I find for me on Social Security, every time I get a raise, they raise my payment without me have to letting them know, informing them. It just automatically happen.
Everything through your pay. They track everything. So, like I said, my mom, she had retired years before. So, but believe me, they go back and they have access to everything. So when whatever's being disseminated from your employer to them, they are keeping track of it. So just know that.
Could you tell me a little bit about the Medigap and how important is Medigap?
So going back to Medigap, Medigap is a supplement policy that is really suggested for those who have Medicare or Medicare Part B or Medicare Part A, as well as those who are on Medicare Advantage policies. What it does is it picks up that patient responsibility. So I'll use Medicare Part B, for example. You have a deductible, and then you also have a 20% coinsurance. Medicare is not going to pay anything until you until you satisfy that deductible amount. That means you owe it. So if you're on a fixed income, it is to your advantage to get a Medigap policy, because what they will do is after Medicare pays, your provider will submit to the Medigap insurance, and as long as they're a true supplement policy, they will cover that for you and pay it. You won't have to pay anything. But it just depends on that type of plan that you select, so that's very important. You actually have to reach out to some of these payers, like some of the larger insurers, because Medigap is usually through a private insurance. So your insurance companies like United Healthcare, Humana, Aetna, all of them, most part, they will offer Medigap policies, but you just have to call them. They'll probably route you to their sales teams, and then they will ask you key questions in terms of determining what the best plan for you is. And then that way you'll be able to be more informed and you'll get the plan that's more appropriate for you. Okay, great question.
I have two. If you're an LLC, you pay your taxes. Your insurance, everything that goes into Social Security, you should be able to get your money back as of retiring. And then what about leaving the country and going outside of the country? Do you still collect your Social Security?
So that's a great question. Because of that, I'm not as familiar going outside of the country. But what I can do for you is follow up with you. I can get your number and your information before we leave today and follow up with you and get you that answer. And then also communicate that as well to the team here so that they can communicate that to you as well. But that's a great question. Great question. I don't want to give you the wrong information. Okay? All right, no other questions? All right, so there are more on the slide, but just in the interest of time, I'm gonna pause here because I know that you've had a lot of information run through you. You probably are gonna go home, your head probably is gonna explode. So I wanna give you time to recover, and then I'm gonna defer to the legal team here on how we next proceed. Okay, thank you so much.
We wanna thank Sister Thom for coming out today. So much important information. And she is not finished. She has more information to share. And so we are going to ask her to come back at a future time to provide us with additional information. But we are so grateful for your willingness to come forward. I know that was a lot of research. Appreciate it. And so I'll turn it over to Pastor.
Thank you, Sister V. Good to see you. Good to see you, Sister V. You belong here. Wonderful. And Anne-Marie, you gave us good, excellent information. We appreciate it very much. I just want to ask one question. Is there any information you have on gap, on on drop. Drop. Okay. Yeah, that's part of FRS. When you're still employed, you can go into drop. A lot of educators do that, all right? And you did? Okay. Yes. That's a good thing for everybody to know. And that brings up a lot of some lump sum money too. Yeah. So we need a continuing session, and we work that out. What we have begun here this evening with this forum is to bring the church as a body up to speed with what we have been doing in our officers meeting focus groups, as well as our election times when we create new committees to meet the needs of the cutting edge that we are on as a people and how that affects our church. And so the cutting edge needs of the congregation, we begin this evening with the Legal Affairs Committee, and the information you see is a wealth of information. And I would suspect that we would have to, when we have the next session, make sure that more people are here, because a lot of stuff took place here this evening, and where people would need to be educated properly about. And so we'll bring another one on tap in a few weeks. Claude and myself are reviewing some of those reports that we got from the focus group a year ago or two, and we're going to roll out presentations in forum-like sessions like this as we move along. So thank you very much, Legal Affairs team. Thank you, Sister Aris, for being behind this, and Sister V and Elder Locke. And we have two young attorneys who are not here, but they're on the team. Two young attorneys from our church who are bona fide, and then we're thankful that Abby is on the team here as well. We're thankful for you. So let's give them a round of applause as a team, because this is helpful to us. All right? So let us... Ella Ruddock? Oh, Ella Ruddock, I'm sorry. You don't look like Ella Locke, Ella Ruddock. Ella Ruddock, sorry, man. Sorry about it. Let's talk to Sister Locke about that. Elder Ruddock, okay. So shall we stand as we bring this to close? And I know that we learned a lot this evening. And now this was being streamed, so we do have it on the site that we can go back and review on YouTube, all right? And let us pray. Lord, thank you so much that you have interest in our well-being. And we focus on elder care this evening and those important aspects of development as we come towards the latter years of life and what it means and to take care of ourselves and our elderly, our advanced church citizens in our congregation, that parents now who are children need to take care of parents then. And so we pray, Lord, that you will give wisdom and understanding, give openness of mind to do the research and to make sure that our elderly are well taken care of. We ask, Lord, that you will give us diligence as people who work now to make sure we put things in place that we need to. May we have more concern about this and pay more attention to it. Thank you that you have your Holy Spirit to guide us and direct us. And we thank you for Anne-Marie, who is blessed with the information, with the knowledge, and for the team to have brought her in for a committee. We ask your blessing upon them. And I ask, Lord, now that as we go out through this week, that you will guide us, protect us, look over us, and cover us with your grace, we pray. In the name of Jesus, we ask these things. Let the people say, amen, amen. God bless you. Have a good evening. Thanks for coming along. Good to see you. All right.